The Revolution Rev 89. I'm Deanna Harrison, reporting for KTSC FM. Welcome to another edition of Twolf Talk. Today we have Carol Doherty, the Director of Student Health Services, and we will be talking about all the services offered through her office, appointments, and billing information, the flu, and vaccinations. Good morning, Carol.
Good morning.
Thank you for stopping by the studio today and talking with me.
My pleasure.
Can you first tell our listeners a little about yourself or positions here at CSU Pueblo?
Certainly. I'm a family nurse practitioner. I've been a family nurse practitioner since 1999. Prior to that, I was a registered nurse and worked in one of the local facilities for about 20 years. When I received my master's as a family nurse practitioner, I went into several medical practices here in Pueblo. And after the third one, I thought it was time for me to retire. So I went to South Carolina for a year, found that I really can't give up healthcare. It's one of those things that once you get into it, it's very difficult to give it up. So I came back, and when I came back, there was an opening in the clinic here in student health clinic. And so I started working as just a provider in the clinic, and 2 weeks later, the director resigned. So I wound up applying for and getting the position as the Director of Student Health and Counseling at that time. Really love it. This is my alma mater. I graduated from here in 1979 and in 1995 with my bachelor's. So I've always been very fond of Colorado State University, Pueblo, or even when it was the University of Southern Colorado. And I think that we have some really wonderful services and benefits that we can give students in our community here. So I was very excited to take over as the director. I've been here, I'm working on my 7th year now as Director of Student Health Services.
Can you also give us the telephone number and location of the Student Health Services?
Certainly. Our telephone number is area code 719-549-2830. And we're located in the psychology building, but on what I call the garden level, meaning we don't have windows, in room 136. So we're towards the back of the psychology building, right under the stairs, that side door. If you come in, you'll see us right away because we are just to the left as you enter the door.
All right. And what services are you offered through this office?
Okay. In the student health clinic, we basically provide any healthcare services that you would get in any type of medical practice. So that means, yes, we see people for acute illnesses. That's primarily one of the largest things we do. We also can do physical examinations. We do sports physicals for the athletes. We also do well-woman exams. So for women who are getting to be 21 and need to have their first well-woman exam or other services, contraception or things like that, then we can provide that as well. We do procedures, minor procedures, obviously. I don't have an x-ray machine, so I can't really reduce fractures, but we can do suturing. We can do removal of warts, moles, any type of small procedure. For students who get an infected cyst or an infected growth on their skin, we can certainly open those, incise and drain, we call it IND, and we can go ahead and suture it up afterwards. We can prescribe medications, both in the clinic where we do have a small pharmacy, and we can write prescriptions. We're staffed basically with nurse practitioner faculty that teach in the nursing program, and they give us time during the academic year. They're there for usually 4 to 5 days a week. That ensures that we have someone available to do any services that may be needed. During the summer, it's usually just me, but we're not usually busy enough in the summer to require anything else. We've expanded some of our services. This last year, we started doing the routine drug screening for the athletes to make sure that we don't have any of our athletes that are using substances, as well as some of the other types of procedures that we can do for the athletes in Masari or in the clinic. So we basically can provide anything that you need to if you were going to go to a regular medical practice.
This hour of programming has been made possible by a grant from Pueblo Community Health Center. If you don't have health insurance, they may be able to help you. Pueblo Community Health Center has cared for Pueblans since 1983, regardless of their ability to pay. You can find out what programs you may be eligible for by calling 543-8711 or in person at 110 East Route Avenue. Rev 89 would like to say thank you to your Pueblo Community Health Center for supporting college radio in Southern Colorado.
The Revolution Rev 89. If you're just joining us, you are listening to the Twolf Talk. Today I'm here with Carol Doherty from CSU Pueblo Student Health Services, and we are discussing the services offered through her office, appointment and billing information, the flu, and vaccinations. Since it's also like a regular practice, are the appointments necessary, or can you walk in?
And that's a really good question. When I did a survey when I was first here in about 2013, and one of the biggest things on the survey was that the students wanted to have walk-in services. So yes, we do walk-in services. We like to call them same day or walk-in. We will try to see you as soon as you walk in if there's someone available to do that and we aren't full in all the rooms. We do like appointments, particularly if we're going to do procedures or physicals. Why? Because that takes a little longer. I can see an acute visit in 10 minutes. Get them seen, get them diagnosed, get them treated, and send them on their way. However, if I'm going to do a toenail removal or partial toenail removal, yes, I do those too. That takes about 45 minutes to an hour. You have to be able to give the anesthesia into local anesthesia as well as take the time to do the removal and stop bleeding. So it really depends on what you're doing. Will I do things even if you need to come in for something and you don't have an appointment? Absolutely. Particularly if you're an injured. That's one of the things that can be an issue with the students on our campus, of course, is because we have a lot of people that fall or they're playing the disc golf and they get hurt and injured, or they're down on the, doing something down in the rec center or something and they manage to get injured. So we try to see those immediately too. If you cannot make it to the clinic, if you call us, we will come and get you anywhere on campus. We do have wheelchairs, we can run over, we can borrow a cart, we can get you and get you moved there. However, if a serious injury occurs where you can't move, probably call us, but then by the time we get there, probably we'll be calling for ambulance services.
How are the services paid for the students receiving care at the Student Health Center?
Our visits are always free. We are paid for from the student fee funds. I have to say that a little bit faster there. And so when you come to see me, you can see me as many times as you'd like, and there's never a charge to see me. We do not charge anything for anything that is no cost to us. So in other words, anything that we do that doesn't impact our budget is free to students. So for instance, if you come in, you have a cold, you need some Tylenol, you need ibuprofen, you need cough drops, you've got an upset stomach, you need Tums, whatever. You come in, we will provide those. Those are over-the-counter medications, and we provide those at no charge to the students. However, getting pharmaceuticals are a little more expensive. So when we have to treat you with an antibiotic or an antiviral or something like that, then there is a charge associated. Our amoxicillin is $5 for a prescription. Some things we can't provide at no cost. So generally what we do is we provide the student with what the cost will be and any options for receiving those services. So for instance, if you have insurance, we can certainly write orders so that you can get medications, testing, any types of things at a facility where your insurance would cover it. Unfortunately, we do not bill for reimbursement right now, so I can't use that option, but the students also have many, many options for paying. Please don't tell my staff because they'll yell at me, but if people really do not have an option to help us with the cost of the services, they're going to get them. They're going to get them anyway. That's kind of my ethical and moral feeling.
I know that students have received some one-on-one counseling services for certain things. Can you explain what is covered and how many sessions a student can receive?
Certainly. For any kind of counseling or mental health services, There are 8 free sessions per semester. That is in the counseling center with one of our licensed counselors. We also have other services that are offered in the counseling center. For instance, we have AccuDetox, which is one of the things that is really helpful for anxiety and for different types of issues that students may have during finals week, midterms, when they're very, very anxious and pressed for time. The AccuDetox is needles in the ear. And yes, I've experienced it, and yes, it is very effective. We have one of our counselors who is certified in that, and another one that's learning to become certified in that. They also offer these services on different places on the campus. So right now on Mondays, the provider is actually in the rec center from, I think it's a 9 to 1 or 10 to 1. We also realize that students, when they first come here, particularly students who are having a stressful situation, may require what we just call normal therapy. So yes, our therapists are available to take appointments for that. We say appointments because when our therapists, our counselors are seeing a student, that time is pretty much booked. They get 50 minutes or longer if they need it, and that is their time. Doesn't mean that there aren't emergencies. And we have had students in crisis on campus. Our director of counseling, Corey Cameron, usually will assess and evaluate those crisis situations and make sure that the student can be seen in counseling and can continue receiving counseling, or if they need to have a higher level of service. So if we need to refer to a community member, a psychiatrist, something like that. If they come in for medication management, I have a nurse practitioner who is specially trained in psychotropic medications who will follow them. There is never, ever a charge for her services. After 8 sessions in the semester, if we haven't been able to help the student, we will go ahead and charge $10 a session for the rest of that semester. If that's an issue too, talk to the director. The director makes that final determination. And then next semester, when you come back in January, you are entitled to 8 free sessions again. There's lots of other things that we do for the students as far as mental health, and a lot of it is education. The other one is we do have the Heart Math program, which is on a computer in the waiting room so that students can come in and do their own biofeedback with the Heart Math program. And it's available for them to sit down just about any time. They may have to wait in line, but it doesn't really, they don't have to make an appointment to see a counselor for that once they've been trained in biofeedback. With the AccuDetox, one of the things that we also provide is where they use the seeds or the beads in the ear. And trust me, last spring, before finals week, we had a line heading down the hall. People who don't even usually come in for any counseling were there to get those to help their test anxiety for finals. So the counseling center is upstairs in the psychology building. It's room 236, so they have the windows and the view. It's at the other end of the building, and their phone number is 719-549-2838.
Do you schedule these through the office, or is there a website that people can sign up?
We have been working on developing a website. Unfortunately, what happens with students being able to do their own appointments through the website is it is a higher cost for the electronic healthcare record and the scheduling software. And so at this point, it is not something I've been able to offer for the students. However, they can call either Student Health Services or the Counseling Center and get an appointment. They can leave a message. We have an email, shs@csupueblo.edu, which we can, and the website also has some links that you can do to get some other information so that you know where, what you need, who you need to talk to, and those types of things. But unfortunately, at this point, the software for scheduling for students is a little out of our reach.
The Revolution Rev 89. If you're just joining us, you are listening to the Twolf Talk. Today, I'm here with Carol Doherty from CSU Pueblo Student Health Services, and we are discussing the services offered through her office, appointment and billing information, the flu, and vaccinations. What is the actual definition of the flu?
Influenza is actually a respiratory illness with sudden onset and severe symptoms. Okay. So I say that and everybody says, what does that mean? Okay. So if you think about you're walking across the street and on the other side is a cold. As you're walking across the street, you get worse and worse and worse the closer you get. If you get the flu, you're walking across the street and you get hit by a Mack truck. Okay. Symptoms are very sudden in onset. Most people can tell you when they started. You have respiratory symptoms, meaning you're congested, you have a sore throat, you have a headache, you have a cough. You also have body aches. You may have, and you have fever. Generally, most influenzas cause high fever, not 100%, but most of the influenza viruses cause a high fever. So if somebody looks like they just rolled out of bed and they are on their way to the emergency room because they feel so badly, they probably have the flu. Influenza is a disorder, an illness that lasts 10 to 14 days if untreated. The nice thing about influenza is we do have vaccines to prevent some of this, just like we have vaccines to prevent measles, to prevent polio, to prevent meningitis. So we encourage everyone to have the influenza vaccine.
How many strands of influenza are there this year? Do you know?
At this point, we always follow what's on the CDC website as well as the World Health Organization. And it's always about a week or two behind for the information, just to let you know, because they have to receive the information from all the different areas they're surveilling. On the week that ended October 6th, so just a couple of weeks ago, here in the United States, we had 107 positive flu tests. Doesn't mean that everybody does it, but for the places where we're surveilling, we had 107. Those types, most of them were type A influenza. Now you're going to get really confused because there are two type A influenzas that we're seeing this year. One is H1N1 and the other one is H3N2. So those are the types of type A influenza we've seen so far. Influenza type B, we've had fewer cases. I think that in the ones that have tested positive, we had about 5 that were type B rather than type A. And so that leads you into what is the vaccine going to cover, right? We have the quadrivalent vaccine, which means it covers 4 strains of influenza. Anyway, the types of flus that are out there are monitored, and flu vaccine is actually starts to be manufactured in January of the year. The CDC recommends that we get all flu vaccines, as many people as we possibly can get vaccinated by the end of October. In fact, we started our first vaccine clinic for influenza on October 18th at our Health and Wellness Fair, which is an annual event, because we really would like to see that students or faculty, staff, and community members that require the flu vaccine be able to get it before the end of October. When you get the flu vaccine, it still takes 2 weeks to build the antibodies against those flu strains. Therefore, getting it in October before the end of October is important because in Colorado, our flu season usually peaks around November, December, January. So usually right during break. Finals and break, absolutely.
What are some of the ways our listeners can help protect themselves from the illness besides the flu shot that you had mentioned?
Okay, one of the first things, and this is something you were taught when you were little, we hope, and continue to do, wash your hands, wash your hands, wash your hands. We could probably really limit contagious illnesses if we would wash our hands better and more frequently. The other thing is anytime you have a respiratory illness, you want to be careful to cough into your shoulder or your elbow. Don't throw discarded tissues when you've blown your nose. Make sure that you wash your hands. And if you start coughing in class and stuff, turn away from your partners in the classroom because you don't want to put those viruses out there, and they are respiratory viruses. So they're extremely contagious in the air. So again, the best thing is, and if you're really, really sick, stay home. I can't emphasize that enough. I know it's difficult. Your faculty always wants you to be here. And, you need to be here for tests and classes and stuff, but you also don't need to give the influenza or respiratory illnesses to anybody.
So the flu is considered infectious.
Mhm.
Is it infectious the whole 14 days or like 2 days?
And that is dependent too on treatment. Yes, you are infectious until the fever goes away, and that's generally 7 days. And so flu itself lasts from 10 to 14 days, untreated. Okay, it can be mild, or it can be very severe. What we are concerned about with influenza basically is the things that can happen because of the influenza virus, which weaken the immune system. So people wind up having pneumonia and being hospitalized because the flu is so severe. So you are contagious as long as you have a fever and you're coughing. If you are treated with an antiviral, that period of contagiousness is lessened.
Can any age get the flu?
Absolutely, absolutely, which is why the CDC recommends immunizing or giving the vaccine to anyone 6 months of age or older. And the people, of course, that are at higher risk are the children, babies, toddlers, and the elderly, because their immune system is not developed or not exactly the same as adults who are in good health. The last death that was reported last year for flu season 17-18 was a pediatric death, which brought the death toll in the United States to 183 last year for influenza-related deaths. So we do recommend that you start at 6 months old. When the first time that a child gets the flu, they have to have it, flu vaccine, they have to have it in 2 doses. Unfortunately, because that's not our population, we do not have that available here for our for any of the students' children. However, the health department, most doctors' offices, as well as many pharmacies also provide the flu vaccine and can give you the immunization.
Do students take advantage of these flu shots that you guys are?
Oh, not really. I got to tell you, and speaking of, 183, that's exactly how many flu vaccines we gave out last year. And in a population of almost 4,000, there are certainly some that can get to other places. People have jobs that may provide the influenza vaccine for them. People who work in healthcare, sometimes some of the companies will provide that in their wellness programs. So I can't say that was the total number of people that got immunized against the flu last year. That was the total number of flu doses we gave out. We try to ensure that we have enough flu vaccine to last through the whole flu season. Just because you get the flu in December and you get influenza A, H1N1, doesn't mean if you haven't been vaccinated that you can't get influenza B in February. So it is never too late to be vaccinated. And so I encourage people to come. If they don't come to the clinic now, but they do have symptoms later, or they want to be protected later, come. We'll have it available.
Do you think it's because people don't think the flu shot is effective? Because I read an article that gave 10% effectiveness number for people who have had taken the shot.
And, unfortunately, research isn't always accurate when it's out there. My suggestion would be that people really look at the websites that have the research-based surveillance of flu. So far, they anticipate this year, and what they have seen so far is about 60% effectiveness for the flu vaccine against the influenza. And again, with just in this country, 107 cases, these are sporadic. They're all over the continental United States. So I can't say, we have 3 in Colorado. Although once we start getting the reports on a weekly basis, I will know exactly where the flu is breaking out in Colorado and which county and how severe it is and which strain it is. But yes, we've had years that the flu vaccine has not been as effective as we'd hoped for. One of the reasons for that is really difficult to make a flu vaccine that's always effective is because we frequently see H3N2, and H3N2 mutates by the time we know it's coming and the time the vaccine is available. So if it's not quite as close as it was when we started working on making a vaccine in January, it will not be as effective against the H3N2 in October. So one of the things is to always be aware that the CDC, the manufacturers of the flu vaccine, are trying very hard to make sure that we get the most accurate coverage that they can provide, which may be anywhere between 40 to 100%. We've never had 100%, but 60 to 70% is quite good coverage.
Now, you had said 60 to 70%, but that still doesn't seem as high of a success percent rate for not becoming infected with the flu.
And unfortunately, nothing is 100%. I need to tell you, it's kind of like, you take medication for a bacterial infection, and occasionally the bacteria that we're medicating for becomes resistant to that antibiotic. That's one of the reasons why, the medical profession tends to not give you an antibiotic unless they know for sure it's a bacterial infection. Because what it does is the bacteria sees that chemical, that cell coming towards them, and they change. And they say, I don't want to get killed, so I'm going to change the way my walls are. And so then that bacteria becomes resistant to a certain antibiotic. The same thing is true with viruses, particularly as we were talking about the H3N2, in that it mutates. It mutates in a short period of time. It can mutate in, obviously within 6 months, and usually more rapidly than that. The flu vaccine can be very good at the beginning of the flu season, and by November, December, the portion that is immunizing against H3N2 may be ineffective. So there's not 100%. 60%, 70%, are pretty good odds. We talk about trying to treat illnesses promotionally so that you don't get them rather than reactively, which means you got it. And so I'm seeing everybody in my clinic with strep throat because they went to an away game and they used the same water bottle on the bus. So, there's just some risks that are out there and that we can't do anything about.
So you talked about bacteria and then earlier hand washing. Does the hand sanitizer work against the bacteria better than hand washing, or?
I would really say that it helps. It's very, very good. And hand sanitizer is a very quick way to get most of the bacteria off the surface of your skin. Nothing is better than good old-fashioned hand washing, which is why they still use it in the operating room where you still wash your hands for 10 minutes. Unfortunately, most people do not wash their hands effectively. They need to be wet. You need to have the soap. The soap's got to go all over. You have to scrub with some force. You have to rinse and not touch the faucet afterwards until you've dried your hands, and use a paper towel to turn the faucet off. Because you wash your hands and they're wet and you touch that faucet, and guess what? There's bacteria on that faucet. Does the sanitizer work? Yes. It's very good. It's not as effective as a good hand washing. And the other reason why is, number one, what do? You put a little bit on and rub it over your hands. You really need to use it effectively by really rubbing up your hands well with it. And unfortunately, that also can cause dry skin because of the alcohol content in the hand sanitizer.
And if you're sick with the flu, is it better to wear a mask so that you don't infect anybody else?
Yes.
Okay.
Now, saying that, there is a difference between a mask and a respirator. Masks will capture most of the things that are close to the person. If we know that there's a lot of bacteria or virus or anything in the air, a respirator is better because it actually keeps out any of those particles. Fortunately, the mask is mostly effective against the types of things that we will see in students because, if you've got the mask on and you're not coughing and taking that mask off and throwing it at someone, you're not as likely to get the bacteria or viruses. But if you were in a situation where we had a pandemic, which means an outbreak and everybody's got something, then certainly providers would generally wear a respirator.
What does a respirator look like?
It's a little bit bigger than a mask, and it's got a chamber that you can rebreathe through, so it actually takes some of that bacteria out of that air that you're breathing in. With a mask, it just basically the air comes through the mask because they're porous and goes out, but it blocks a lot of the bacteria and things that go out with that when you breathe out.
How can this flu infection kill a healthy individual?
And that we rarely have really healthy individuals that die from influenza if they're cared for. Unfortunately, there are a lot of people that are considered healthy individuals that may have issues that are not known. One of the biggest is a weakened immune system. And so that is the children, infants, and elderly. The immune system changes as you grow. So your immune system, when you're born, most of the antibodies are from the placental blood supply. So infants, when they're first born, have about 3 months of antibodies that they receive from mom. Okay. After that, that's when we start vaccinating infants. Elderly start losing some of their immune system as they age. So when they're 65 or older, we recommend different dosing. However, there are a lot of people that are healthy individuals, but that may have some underlying illness, such as diabetes, heart disease, any kind of respiratory illness, that they may have asthma, something like that. And those people are more at risk for developing what we call comorbidities, or things that happen along with the flu. Particularly with asthma, in children or adults, we will see with that is it gets very restricted in their airways. And so they are at risk for developing pneumonias, as well as developing an inability to breathe. So healthy is not always what it looks like, but generally speaking, there are still people who are considered healthy that may have something that makes them more at risk for comorbidities, and that makes them more at risk for death.
There's been a lot of chatter over the past several years regarding the vaccinations.
Yeah.
If you can enlighten us.
And I am a great believer in, the freedom to choose what you want for your health care, for your body. We also have unfortunately, many people that look at some of the research that has been done about immunizations and decide that the risks are higher than the benefits. So they choose not to be immunized, or they choose not to have their children immunized. Several years ago, about 4 years ago, 4 or 5 years ago, there was one case of measles from a child at Disneyland in Anaheim, California. By the end of the surveillance and checking for those measles cases, there were over 600 worldwide from that one exposure. So you have to look at the risks and benefits. The risks are that if you're not immunized and you contract that disease, then it may be worse. If you are immunized, certainly there's always a risk when you take vaccine. There's a risk because most of the vaccines have an egg component. That's how they're grown. And so people who are allergic to eggs may have an issue. Can we work with that? Absolutely. Yes, there has been a small correlation, not statistically significant, and everybody's going to yell at me, between the MMR vaccine and autism. They really do believe that it's more that the MMR vaccine starts a genetic factor that then causes the autism. But unfortunately, that still is out there, that if you take this your child has the MMR vaccination, they may get autism. That's true. They may not, even if they don't get vaccinated, they may have autism. So unfortunately, risks and benefits are how you make those decisions. I would just suggest that people look at the one disease we have not seen in 50 years, and that's polio. Polio, which used to cripple and kill people and cause a lot of significant health problems for the rest of your life, is virtually wiped out in the United States because of the vaccine.
Back to that one case, how did they track it in the case and then see it go to 600 others?
Well, that's what you do. And it's just like if you go to this university and we get something, here, They have your name, your address, your phone number. And so if you are reported that you have something, they also then can look up your class schedule and look at every single class you've been in, the professors and all of the other students that were in that class, plus your roommates, plus anybody that you have a relationship with, plus your sports if you're an athlete. That's basically what the CDC or the public health department does when there's an outbreak of a contagious illness like that. So, for instance, if the child that had it at Disneyland and it was reported, then the public health department in Anaheim started tracking contacts. And that meant tracking all the people that they could get a hold of that were there during that time period, checking all of the planes for people who had flown to other areas, checking the areas where they disembarked, including internationally as well as nationally, and following for the incubation period of measles. And that's how they get that number.
What would you consider some of the most shared misconceptions about getting vaccination and immunizations? There we go.
Oh, they're not going to work. I'm going to get the flu anyway. That's probably the biggest one I hear, and, I can't say 100% that that's true. I've gotten the flu vaccine. This is my 40th year in healthcare. I've gotten the flu vaccine 39 times. So I missed it 1 year. I've had the flu once in 40 years. Once. So, and it wasn't nearly as bad as it was when I had the measles. I will tell you that. So the measles put me out for 2 weeks, and it was terrible. And the flu, actually, because of the immunization, I was only sick for about 3 or 4 days. So one of the fortunate things that we have now is that even if you get the flu, even if you were immunized or not immunized, there's treatment for the flu. There are antiviral medications that if we start them within the first 48 hours of your symptoms starting, they can stop the replication of the flu virus and make the course of the illness much shorter. So instead of talking 10 to 14 days, you're talking 5 days, okay, where you're uncomfortable. The other thing is after you start that antiviral, you're no longer contagious. And that can be an important issue for families who have at-risk individuals, like children, like grandparents, like people with a suppressed immune system. So getting that vaccine helps you protect them as well as yourself. But I have, and frankly, the two biggest things are number one, I don't like needles. And, I've got to tell you, that little needle that we do the flu vaccine in is really, really large, and we're going to make it very painful for you. Unfortunately, sometimes there are just some things you need to do, okay? The second one is, I'll get the flu anyway. But as we just talked about, there are treatments as well as it really decreases the risk of the flu and the risk of you giving the flu to people that are at risk.
Are you seeing anything other than the flu coming into the campus clinic?
Oh, obviously. We always do. 55% of our acute visits last year, in the last fiscal year, were for respiratory illnesses. Now, that doesn't mean they were flu, because we didn't have that many cases of the flu. I think we wound up having about a dozen cases of true influenza. But you get bronchitis, you get, a sore throat, you get ear pain, you get a cold. And so 55% of the students we see are seen in our acute visits, meaning they come in sick, are seen for some type of respiratory infection. We have another, I think it's 18% that come in for urinary tract infections. And that's because, unfortunately, people think it's not okay to get up and leave your classroom and go to the bathroom when you need to go. And of course, faculty don't always want you to do that. But, it is something to remember, that to hydrate well and go when you feel the urge to go. And the rest of them, about 18% were preventative visits that we saw. And then the rest fall into other categories, which are things like lacerations, abrasions, checking for STIs, doing other types of health planning or health checking. So, for instance, if they've got a growth on the skin that they're concerned about, coming in and having a dermatological look at it so that we can say if it's something dangerous or not. So, yes, we see a lot of other things besides just the flu.
Is there anything else that you would like to cover today?
I guess I would say that and I think that this is an important thing to note because I know students here, and many of the students here are on a limited budget. And you need to know that getting the influenza vaccine is much cheaper than getting the disease. If we're going to do medication for influenza, there are actually 3 medications that are typically used. The most common one and the cheapest is Tamiflu. The cash price for it is over $100. We do get coupons for those, which makes it down lower, but even still. Relenza, which is the second one that's given, is higher. And so even with the coupon, it's around $80 to $100, depending on the pharmacy. The last one, Rapavir, which is much newer and, of course, always much more effective. The cash price is $948 for the treatment. Treatment for these is 5 days, guys. 5 days. So it's
the 900 each time?
No, that's the 5-day treatment costs $948 for the cash price for the newest antiviral. So you look at that and you say, okay, I go get a vaccine for $15, or I pay $120 for Tamiflu when I get sick. I'm out of classes for 5 days, and I infected all my suite mates and roommates. So you have to weigh that as well. Treatment, you can get through the flu if you have no risk factors without any treatment, just symptom treatment. Cough drops, ibuprofen, sleep, hydration, chicken soup, all of those things work. But it's also going to be a longer illness than it would be if you had the vaccine or are treated with antiviral.
I'd like to thank our guest, Carol Doherty, coming
Thank you so much.
by the station and talking with us about student health services, vaccinations, and the flu. I'd also like to thank our listeners for spending time with us this morning. Join us again next week starting at 7 for another edition of Twolf Talk. Stay there. The greatest music ever created is up next on The Revolution, Rev 89.